PCOD. What is PCOD? Everyone start writing in the chat. What is PCOD? I'm waiting for the answer. Please write. Very good. What is polycystic ovarian disease? PCOD, right? So PCOD full form is polycystic ovarian disease. What is it? Basically, the problem is there are ovaries. On both the ovaries, there are cysts. Because there are cysts on these ovaries, cyst means some small cavities, some bubbles. Some bubbles have occurred inside the ovaries or on the surface of the ovary. Now, because of this, the tissue of the ovary is damaged. If the tissue of ovary is damaged, there are two problems. What are those two problems? One, the eggs will not be formed. And two, hormones will not be formed. So there are two problems in polycystic ovarian disease. One is eggs, fertility, serious issue. Second, hormones, serious issue another. Because now eggs are not forming, fertility will not happen. Because eggs are not forming, menstrual cycle will be irregular. Hormonal imbalance. Because hormonal imbalance is there, the girl will gain more weight. She will have infertility problems. She will have menstrual cycle difficulties or irregular cycles. So basically, if you see polycystic ovarian disease, the problem is one, there are cyst bubbles in the ovary. Because of this, eggs and hormones, these two are the outcomes, right? Because of these two things, what is happening? Number one, infertility. Number two, hormone is high. Now, there is insulin in the body. Insulin secreted by pancreas. What does insulin do? Very good. It reduces the blood sugar. Now, opposite to insulin, there are certain hormones, right? For example, I will give example. When you are stressed, your sugar level spikes because the cortisol hormone responsible for stress, the adrenaline, they act against insulin. That is also similarly happening here. If you see, some gynecologists, they prescribe anti-diabetic medications in PCOD cases. One of the fundamental reason is this, right? Then again, also there is some insulin-like growth factor and all, so we should not get into that deep depth. Now, what is the cause of polycystic ovarian disease? Start writing in the chat. What is the cause of polycystic ovarian disease? So have you understood now? Very clear terms. You understood what is PCOD? Polycystic ovarian disease, write down. So PCOD causes obesity or obesity causes PCOD? Difficult question. Huh? Lifestyle. PCOD is probably not a lifestyle disease, you can say. It's a developmental disease. So listen carefully now. Lifestyle means you have a sedentary life, you smoke, you drink, you do something which you should not do, and this causes hypertension, diabetes, obesity. This is called lifestyle disease, correct? Now, developmental disease. Developmental disease means when a girl is growing, she is probably predisposed for PCOD. Not every girl is going to have, not every obese girl is PCOD, right? Not every sedentary lifestyle is PCOD. So there are some predisposed girls. When they're growing, they go through the teenage phase and then there is a start of PCOD. Now in this PCOD, there is a range. Everyone is not going to have an equal. Some of them have small cyst, less number of cysts. Some of them have small cyst, more number of cyst. Some of them have bigger cyst, less number or more number. Now, the problem is if you have bigger cyst, either it is less or more. The tissue damage, ovary is very small. So the tissue of ovary, which is going to work normally for fertility, not going to work. The part of the ovaries which is going to secrete hormone, it will not secrete. So this is causing more problem. The second problem is because there is a cyst in the ovary, if it is a big, it can cause torsion of the ovary. When this torsion of the ovary happens, it needs urgent surgery. immediate surgery, right? So we'll not focus on the surgical part. We'll focus on these three ranges. Okay. Small cyst, few cyst, small cyst, more number. Large cyst, maybe small or more. So these are three categories we can divide broadly. Understood? Now, how do you check whether someone has PCOD? How will you check? Please write down in the chat. So PCOD has hereditary predisposition. And we will do ultrasonography, USG. USG is typically diagnostic. Will full bladder, you will do USG. Plus, you may do some hormonal test and all. Right? Typically, ultrasound helps you detect for maximum cases whether there is a cyst in the ovary. So cyst means a bubble type of in the ovary. Okay. Now, what are the symptoms? Now, when we say weight gain, pimples, more hair, obesity, irregular period, and cramps, all those things, infertility. So these are called symptoms. All these belongs to symptoms. Now, if you want to divide the management part, now listen carefully, pay attention. If you are doing some other time pass work, stop doing it. So small cyst, less number of cysts. Here, what you are going to do, you will tailor exercise. Objective of exercise is not to reduce obesity. Objective of exercise is mobility. You start your movement, try to reduce some fat in your body, and try to increase your insulin levels, insulin sensitivity. When you exercise, your insulin sensitivity improves. And because somewhere the mechanism is not still clear, the PCOD is closely linked with opposite of insulin. Right? There is something called insulin like growth factor. It plays a role. And because of it, one of the medicine which a gynecologist will give is anti-diabetic, oral anti-diabetic, glimepiride and all she will give to manage PCOD. If it is bigger cyst and the problem is very severe. Small cysts, they can be managed with lifestyle changes. Sometimes some students, some counselors, there are around 500 counselors working with my team. Most of them are into the psychology business. So because psychology is an easier business and a lot of clients, they are ready to pay easily. And around 100 are for nutrition dietetics and others are for legal consultation. So when this nutrition counselors initially they join after the internship, first they go through the internship, then they join my team. So when they joined, they are like, sir, PCOD, what should I give? So I'm like, you cannot give anything. PCOD is not when you change a diet, it will change. It is not going to happen. Diet is one small factor which you need to take care. PCOD is major of exercise, yoga, meditation, relaxation, right? Like Dr. Dipti said, stress is one of the factor for PCOD. I will tell you another factor for PCOD is impulse. So there are some girls who have impulsive behavior. There are some girls who cannot control their cravings for food. Right? Uh, you go to one Pani Puri thela today. Okay, everyone will do this experiment. Okay, in this week. Next time you go to Pani Puri, you stay there for 1 hour. You observe all the girls who are coming to Pani Puri thela, and you will see they have certain body figure, and they have from their face you can see that they have a lot of craving for such kind of food. So food craving for spicy and all those chatpata types food is one of the indicator that someone may develop PCOD. Now, if you talk to your nani or someone dadi, she will say, "Hey, don't go and eat pani puri every day, right? It is harmful for you." Technically, she is right actually, right? Because someone who has been eating pani puri every day, she cannot control her impulse. It means she has a lot of craving. Why this craving is happening? Because there are some hormonal changes happening. And that is one of the indicator of PCOD, early indicator, or strong cravings for all those things. Yeah. PCOD. Primary is not food. Food is last. Always remember this. As a nutritionist, as a dietitian, you should go with a holistic approach. You should not, no, I'm a nutritionist, I'm going to give her some chart. I tell you what happens with this chart you give, okay? Now, everyone, how many of you had their relatives admitted to hospital and got some diet chart? Write down in this chat. How many of you had this experience? Someone gave you the diet chart and you threw it in dustbin. So write down, I got the diet chart and I threw it in the dustbin because I could not understand what is written there. Yeah, there is a paper and so many things are written. Sometimes in Hindi, Marathi, some English, and some calories are written. I don't know. I'm a doctor. I'm a nutritionist. I have a practice since 20 years. I don't know. I have been training with NSCA since now 6 years, but I don't know what she is saying. And what they do, they give the diet chart and say, huh, follow this. I'm like, hey, what follow this? I do not understand a single word. What you're talking? I'm a doctor, still I don't understand. You have to tell me what I should do. This is your breakfast. This is your lunch. This you eat. This you don't eat. You tell me, yaar. I don't understand this paper. And anyways, I cannot read other than English. So no one taught, no one explained me, despite asking. This nutritionist, she's like, everything is written there, you can read. You are educated. I said, yeah, actually, point. You have a point. I am educated. So I put that paper in the dustbin immediately in front of her. And I showed her that this is the value of your nutrition paper. Wrong. Okay. Don't give a client a piece of paper downloaded from internet or someone else is giving since 100 years, other nutritionists are doing that. That is a wrong process. You are not going to do it. You are going to counsel the client, consult the client, sit with the client 15 minutes, 30 minutes, 45 minutes. Tell the client, explain them. What are the things you should do? One, two, three, four. What are the things you should not do? One, two, three. And tell them when to come next. Follow up. Giving a piece of paper where the table is mentioned or some long things are mentioned, useless. Absolute useless. I'm not going to read it. I'm not going to follow it also. Right? So if you explain to the client what is it, why you should do it, what will you benefit if you follow, the client will follow them. You agree? So if you are going to explain to the client what is it, why they should do it, and what is the benefit of following your plan, write down, I will do that. If you don't write, you will become average counselor. Those who want to be best counselor in their town, they will write, I will do that. Those who write, they will become. Very good. Ramya, Ankita, very good. Out of 52 people, okay, 3, 4, 5, 6, very good. Very good. Not everyone wants to become a best counselor in their town. Some of them, they prefer to be average. Nothing wrong with that. It's okay. And some of them are completely hopeless. They are like, it's okay. I'm attending the class for you, sir. It's okay. No problem. So you should attend actually Monday classes for psychology counseling. Yeah. Those who are not replying, you know what is your diagnosis? Good, very good. Those who are written, you will do. Explain to the client what is the plan. Explain to the client why they should do it. Explain to the client what is the benefit. They will follow 80% times. If you give a piece of paper, they are not going to follow. If you give a piece of paper where you have written a lot of things and the calories in the bracket, no one cares for the calorie. The client doesn't care, right? Just do an experiment. Your parents love you most. Your child loves you most. Give a piece of paper to your parent and say, this is a calorie you have to take. They will like, hey, rubbish, get out. You need some mental surgery. Yeah, you need psychology counseling. That's the world. So don't stick to the calories and all. You should stick on the complete process, the holistic approach for every client. For PCOD, the food is the lower component. The major component is lifestyle. Now, what are the things you are going to tell to the client of PCOD for lifestyle? Write down in the chart. Whatever. If you give wrong answer, it's still okay. But at least you are trying it. Good. Write down in the chart. Exercise, yoga. Very good. Very good. Next. Ask their routine. Okay. Very good. Exercise, yoga, eat on time. Yeah, that is important. Sleep on time, eat on time, study on time, meditation on time, be happy and relax. Wow, that's a very good thing. Walking, no junks. Yeah, difficult to say, difficult to do. Lifestyle change, be happy. Yeah. It's like there is a beggar on you meet on the street and you say, hey, stop begging, try to become rich tomorrow. And the beggar is like, yeah, yeah. So someone is emotionally disturbed and you say, hey, stop being depressed, start being happy. It's like that. Hey, what are you talking nonsense? So saying be happy is easy. Getting happiness is difficult. And that is why it is important you do psychology counseling also, right? A successful nutrition dietitian is one who does nutrition, diet, and psychology counseling. Most of our students, they do this parallelly both together so that they can learn both parallelly and they can manage the clients like that. So when any client coming to you, either it is obese, most common things, or lifestyle diseases, or PCOD, they have anxiety, they have stress, they have depression. So you need to manage them. Okay. In our program of psychology counseling, you learn all the conditions and you learn what are the diagnostic symptoms. You will learn how to talk to the client, how to actually counsel them. We don't teach you what are the theories of counseling and models of counseling. Not useful. We teach you exactly how should you counsel a client. How will you manage a client for every condition? Anxiety, stress, depression, OCD, bipolar disorder, personality disorder, eating disorder, all other things, right? Depression and all. So it's a very good. So you ideally most of the students they do it parallelly so that they can start applying together. That becomes a holistic approach. So psychology counseling, number one. Number two, lifestyle. In the lifestyle, exercise, yoga, meditation, walk. Okay. Now, if you tell them that start going to the gym, you yourself are not going to the gym. Probably you have some condition. Someone has told you you should go to gym, or your spouse has told you you should go to gym, or when your mirror has told you that you should go to gym, but you are not going. And you tell a client who is an unknown stranger, you say, hey, from tomorrow you start going gym. Probably they might get excited and pay for the gym, but they are not going to go. Don't keep such a huge target. Small target. What is a small target? Start helping your mother for household work. Start helping your father in his office work. Start helping your siblings for homework. You feel happy. When you help someone, you release happy hormone in your brain. So there are four happy hormones. Does anyone know what are the happy hormones? Four happy hormones. Who will write down? Write down. Very good, Ankita Mehta. Dopamine, endorphins, oxytocin, serotonin. Very good. Good, good. Very good. Serotonin, dopamine, endorphin, oxytocin. Dopamine is released when you help someone. Don't go to outside strangers, don't go to NGO to help. You start helping your sibling for the study. You start helping your mother, start helping your father, start helping yourself. You are your number one priority. Right? Start helping yourself. Then next, go to a walk in the garden or do gardening. Either of these two things, they are aerobic exercise and it releases a lot of stress from the your okay. So either you walk in the garden or if you have garden at your home, tender your gardening. Number three, find some hobby. Find what is your interest. If you like painting, do that. If you like writing, you do that. If you like singing, playing flute, playing busy, you do that. Okay. So the important is you learn something new. When you learn something new, again, a happy hormone is going to release. You cannot think as a nutritionist, that is average nutritionist. You have to think holistic approach. Nutrition, diet, psychology, lifestyle, okay, medicines. End will be medicines last because every medicine is going to have some side effect. So you doctors they will balance. You are not going to give medicine. Doctors give medicine. So a gynecologist is not going to give medicine for this cyst, small. She's going to give for bigger cyst because she knows every medicine has a side effect. So here, the benefit of the medicine is more than the risk of the medicine. Benefit is more than the side effect. And that's why she will give here, not here. For here and here, you will have to psychology counseling for stress relief, anxiety, depression, lifestyle changes, and then comes nutrition and diet. Clear? Questions. If you have question till now, this is your opportunity to ask. We have 3 minutes for the question. Those who ask question will be my favorite. If you ask difficult question, I will tell you, you go your homework and do it. If you ask easy question, I will answer it very sincerely. If you ask foolish question, I will like you. You will be my favorite. Because everyone has this foolish question, but others are afraid to ask. You are courageous. You are asking that foolish question. I will answer it very sincerely. Okay. So if you have foolish question, difficult question, easy question, you ask. Don't worry. I will answer it very sincerely. Binita has asked an interesting question. How to improve happy hormones? I will send a video on this. So on my personal channel, there is a video. I will send you both the links. Okay. So you can click on this link and search happy hormones. Or if you go to YouTube, search how to release happy hormones, Dr. Pawan Mittal. You will find a video by me on my personal channel and you can watch it. So there are steps given, systematic steps to release happy hormones. This is a video link. Okay, I will take one question each. Okay, one by one. Now, are there some foods that help reduce cyst? There are not, scientific research is not there. See, whenever you read somewhere on Instagram, TikTok, or somewhere, you need to find out who has said this. Someone says, some TikToker says that, okay, eating something, eating marble stones reduces your cyst. Don't trust it. Not necessarily true. What is a scientific study? How many patients were there in the study? So any study should have case control. It means there should be the patients of PCOD. There should be normal clients, normal subjects. Okay. For both these cases, you give some medicine, some food, and then you follow up with them. Then you see what is the effect. That is one option. Option two, you have 100 or 1000 ideally actually. 1000 PCOD here, 1000 PCOD here. And for this, you give them one medicine. And for these people, you give them placebo. You don't tell them that this is a placebo. Placebo means a dummy medicine. You tell them that we are giving you same medicine. Both of you, we are giving same medicine. Only you know who is in placebo group and who is in real medicine, who is taking real medicine and who is in placebo. Then you follow up with them. Then you see whether there is a statistically significant difference in both the groups. 0.92%. If 92% should be the statistical significant difference. If it is that, then you accept, okay, now this medicine has beneficial effect in this PCOD. If these people also benefit from the dummy medicine, it means not useful. It means not useful, okay? So the dummy medicine should not work and the real medicine should work. And the difference must be more than 92%. Then only you say this medicine works. Similarly, if you say any food, does it help reduce cyst? There has to be this scientific study. Right? Those who do PhD with me, they do such kind of studies and they come out with a real research outcome that helps the field of nutrition and psychology. And then book gets published for them. So book becomes a second revenue source for them. Pragya has asked an interesting question. Is PCOD diet similar to diet in diabetes? See, in diabetes, the objective is glucose control. In PCOD, the objective is cravings control. Like, you want to reduce carbohydrate, you want to reduce fats, but your objective is not a strict glucose control. Your objective is probably reduce the obesity. And this obesity is happening because of the PCOD. And your objective is to do a lot of exercise so that your body becomes insulin sensitive. It neutralizes somewhere. Right? This mechanism is not so much clearly known that how this exercise benefits in PCOD, but it is well documented by research that yoga as well as exercise, it helps PCOD. Reducing weight in PCOD, it increases your chances of fertility. Very clear. So if you reduce weight, your ovulation will start. You know, the problem with PCOD, when it reaches this stage from year to year to year, menstruations are irregular, ovulation is not happening regularly, fertility is lost. That's why if you see some of the clear cut from the figure only, from the body figure, you will find out who has PCOD. Once you see 100 clients, and you can guess, you can ask them, like, since how long they are married, since how long they are trying for children, and you will find the answer, which is not a good answer. Aishwarya has asked an interesting question. How do we nudge our clients to follow what we suggest and help them be consistent? Very good question. The answer is you explain them step by step what they are supposed to do. Then tell them why they should do. Then tell them what is the benefit of doing each of these things. And follow up with them. Either follow up, you can drop a WhatsApp or you can tell them come back to you after a few days. Now, after all this, there are going to be clients who will not comply, who will be like 50% compliant, who will be 0% compliant. You cannot do much about that. Nikhila has asked an interesting question. Insisted to me, most part of ovary is removed. It depends on the cyst size. Okay. See, if someone has ovary is a small thing. If someone has a bigger cyst, already that ovary is completely damaged, almost damaged. So that ovary will not give ovulation now. So the ovulation will depend, the pregnancy will, fertility will depend only on the other ovary. It's not necessary both ovaries will have cyst. It can be both. It can be one big, one small. It can be one has zero cyst, one has some cyst. Anything can happen. Okay. So already the cyst, if it is bigger, then ovary is already damaged. And only if the cyst is bigger and there is a risk that it may rupture or the cyst may cause torsion, then someone will go for cystectomy. Cystectomy is not a routine procedure. How to improve happy hormones? You can watch the video on my personal channel. Viva has asked an interesting question, a gynecology question. There is a difference between PCOD and endometriosis. Good question. See, PCOD means the ovary has bubbles, the ovary has cyst. And because of this, there is infertility and there is a hormonal imbalance. In endometriosis, now understand the physiology. Inside the uterus, there is a lining. And this lining gets ruptured every month, and that is what is the menstruation bleeding. Now, this lining, endometrial lining, it is called endometrial lining, which is responsible for bleeding. This endometrial lining is by some defect, developmental defect, it is found outside the uterus also. It can be in the abdominal cavity, it can be in the fallopian tube, it can be near the ovaries, it can be on the intestine, it can be in the pelvis. So what will happen? Every month, your hormone drops, progesterone drops. When the progesterone drops, endometrial lining sheds, endometrial lining leaks. That is menstruation. Now it is happening in the uterine cavity, so that is getting out. But the problem is there is some endometrial lining in the pelvis, around the fallopian tube, around the ovary, around the intestine. They will also leak. They will also shed, right? They will also bleed. Now, where is this bleeding going to go? It is going to stay there only. There is no cavity to come out. That is what causing pain in endometriosis. Okay. So endometriosis means there is an endometrial lining outside the uterus and it also bleeds every month. And that is what causes severe pain. For Dr. Valli has asked an interesting question: how to treat psychological problem related to PCOD? What are the psychological problems in PCOD? Everyone write in the chat. What are the problems in psychological problems a girl going through PCOD faces? Write down. Very good. Anxiety, stress, depression, irritability, frustration, anger. Right. On my channel, there are videos for answering almost all of these things. You can watch them. Plus, if you enroll for psychology counseling course, you will learn actually how to counsel each of the client. This book is available on Amazon also. If you want to buy a book, it is available on Amazon. You search by my name, Dr. Pawan Mittal. If you search, you will find this book. If you want this book plus classes and proper learning and internship, then you can join the course of psychology counseling. You will learn how to diagnose each of the condition, how to counsel the client, how to manage them, what are their common questions, and how to answer it. You will learn very systematically. Practitioner level program. And when you do nutrition, dietetics, psychology all together to the client, that is a holistic treatment. And you should do it parallelly, both the courses. Hina has asked an interesting question. Is it possible that sometimes doctor mistakenly diagnose cyst? Now, the diagnosis of cyst, ovarian cyst, it has three components. Okay, majorly it relies on two components. One is the symptoms: infertility, obesity, irregular menstruation. These are primary three symptoms. The second component they rely is on ultrasonography. Ultrasonography is a confirmatory diagnosis. So any test, when you do ultrasonography, you have to first find, a gynecologist will first try to find where is the ovary. Now, many times ovary is not visible. It is so small and there are so many organs in your abdomen, so ovary is not visible. Then they cannot diagnose. So what will happen? There is a cyst, but they miss out. Correct? But now think the other way. They find there is a cyst on the ovary. This is most likely to be positive. This will not be false positive. Very less likely. There are obviously some chances, but it is very less likely. Because why she is doing ultrasonography, USG? Because there is a symptom. There are irregular menstruations, infertility. That's why ultrasonography was done. Now on ultrasonography, she finds that there are cysts on the ovary, bubbles on the ovary. That is confirmatory diagnosis now. This is not a false positive. So if a doctor says on sonography there are cysts, confirm. If a doctor says on sonography no cyst, confirm. Good. Okay. Then there are maybe other reasons for hormonal changes in fertility. You have to evaluate. Khushbu has asked a very interesting question and very difficult, which is commonly faced by the clients. The client wants to come out of PCOD, but because they are depressed, they are anxious, they are so much worried, stressed, they are like zombies. They don't get up from the bed. They are like living zombies, walking dead. They don't know where they're living, where they're dying. They don't know what they are doing in the world, right? And they don't want to leave. They are so much depressed. They don't want to improvise. That is natural. That is why if you are like nutrition, diet, it will fail. It has to be psychology first in PCOD. Number one is psychology. Because when you do psychology counseling, you can heal them. You can manage their anxiety, stress, depression. Once this barrier is removed, this is barrier, anxiety, stress, depression. When you remove this barrier, they will start thinking for themselves. They want to live again. They want to improve again. Someone who is dying, someone who is broken inside, someone who has already lost hope, she doesn't want to improve here. Yeah, she's completely broken. So that's why in PCOD or most of the lifestyle diseases, first is psychology counseling in anxiety, stress, depression. Then comes lifestyle management. Then comes nutrition and dietetics. You cannot start with nutrition. That a client will say, yeah, I will follow, ma'am. I will follow. Pakka, pakka. And she will never come back to you. Right? and you will feel that you are not a good counselor. And that's what happened. Yeah. So first, you need to heal their psychological problems. Then tell them what are the lifestyle. You cannot tell a depressed patient, hey, you start gymming from tomorrow. You cannot say a hopeless person, hey, you be happy, huh? She'll be like, yeah, you are not happy yourself and you are teaching me to be happy. Yes, seriously. Like, how many of you think that you are happy? Write down in the chat, I am happy. Write down. And then we will call your husband and check. Or we'll call your wives and check. Yeah. Or your parents. Write down anyways. If you feel you are happy, it's good actually. No need to check. It was just it's good if you feel that you are happy. So being happy is a rare thing, and you are doing good. So in lifestyle, when you talk of yoga, exercise, meditation, walk in the garden, don't forget hobbies and learning new things, because when you learn new things, you release happy hormone. Don't forget to add help someone in your family. Don't go outside and help people, strangers. No, help people in your family. That releases your dopamine. That is a way to release happy hormone. You can share my how to release happy hormone video with your clients also. If you search in YouTube, go to YouTube, how to release happy hormones, Dr. Pavan Mittal, you will find this video. Or the link is there in the chat. The second is um, I missed out one thing. Huh? I will come to okay. I will come to that again. There was one point in the lifestyle which I wanted to add. I missed out. Okay. Subhamati has asked interesting question. Is PCOD completely curable? So PCOD is a condition. Your objective probably is not to cure it completely. See, once the bubble is formed, once the cyst is formed, you cannot do anything. What is your objective now? You don't want cyst to grow. You don't want number of cysts to be more. You want to keep it less. To do all this, you have to manage your lifestyle things. You have to try to reduce your anxiety, stress, depression. You have to reduce your cravings. You have to try to keep yourself occupied. You have to do some walk, regular exercise, right? Diet and nutrition has the last scope for PCOD. After that, obviously, medicines are there. But from a nutritionist and dietitian perspective, major is going to be psychology, then lifestyle. PCOD, PCOS, you can consider both are same. S means syndrome. So why it is called syndrome? It is a mix of diseases, hormonal imbalance, obesity, infertility, lack of ovulation, cyst in the ovary, all those PCOS. Shruti has asked an interesting question. If PCOD not treated, will it turn into tumor or cancer? So answer is no. It will not turn into cancer. Now, since this topic has come, okay, ovarian cancer, is there a medicine that prevents ovary cancer? Who will answer this? Anyone who will answer will be my favorite student. Think first. Is there a medicine which is very common and it prevents ovarian cancer? It is known. Statistical data is there. It is known to prevent ovarian cancer. Very good. Contraceptive pills. Contraceptive pills are known overall, they are known to prevent ovarian cancer. They also prevent uterine cancer. It's a very common medicine taken by married women or active women, and it is known to prevent, it protects from ovarian cancer and uterine cancer. Normally, a polycystic ovary doesn't develop or it doesn't have any predisposition for ovarian cancer. No. Okay. Ankita, you can talk to me separately. Now, because of this, there is a hormone. There are two things. One is ovulation, second is hormone. Because the hormonal imbalance is there, a girl will have opposite characters. What is the character for a girl? Feminine character, a clear skin, less hair, right? So opposite will be coarse skin, oily skin, more hair. And because of more hair, oily skin, coarse skin, there are going to be acne. Okay. Now, if someone says that acne is because of this, so there are ways to prevent it. This is also very important. Okay. Now, a PCOD girl, she has the look, the self-esteem issue, the look issue. Okay. Now she feels that she is obese, she's not looking beautiful. She feels that she has acne, she's not looking beautiful. So now, are there some tactics you can deploy to prevent acne? So listen carefully. All those people, all those girls who have acne, you listen carefully now. You will have to do this, even if you believe or not believe. Okay. Wash your face with a soap-free face wash. My personal preference is Lakme face wash. Okay. Don't use other lower companies, lower cost. No. Now Lakme has various strawberry, lemon, kiwi, white, brightening, micellar water, all those. Okay. So I personally like white direct bright radiance white packet is there like me. So that is soap-free face wash you have to use because the soap dries your face and it releases more oils inside. Then there is a rebound acne. Number two, change your pillow cover weekly, twice weekly or twice weekly. Change your bed sheets weekly. Whatever you linen you wear and the bed sheet. Both the things you have to change weekly. There are people in the world who do not change it for 1 month, 2 months, 3 months, right? When you are doing shampoo on your head, do not let that water percolate on your face or upper part, which are acne prone. When you are using conditioner, do not let it percolate on your face or upper part. After you use conditioner, then you do face wash. Almost daily or alternate day shampoo. If you have dandruff, dandruff is one of the cause of acne. So if you have dandruff, it's okay even if you use normal shampoo, but you have to use it frequently, daily or alternate day. I also, you might say that, sir, you have small hair, so you can say it easily. I used to have 2 months back, there are videos, old videos. I used to have hair like this. Okay. I used to have a pony and all. Every day I used to do shampoo because I'm predisposed for dandruff. So, and when you do shampoo, don't do it for just one time and just wash. No, it has to be 2 times, 3 times in a single sitting. First will be wash, just debris removed from the scalp and the hair. Then you scrub your second time again, take the shampoo. After rinsing, take again. You rinse first time, then take again, and you scrub it at your scalp vigorously. Massage it at your scalp. Okay. And that's how you remove your dandruff on the scalp. Very clean. Then again, if you are not satisfied, if you think that the lather is not so much, after rinsing, third time again you do, or 2 times is also sufficient. If you do this, you will not have dandruff. If you have less dandruff, no dandruff falling on your face, you will have less acne. Okay. If you go to a gym, if you go for a walk, after coming back from a walk, wash your face with face wash. Many people, they come from a walk, they come from office, they come from outside or gym. They don't wash their face, they don't bath, they don't bathe. That is completely wrong. Ideally, you should bathe. If you are so lazy, then at least wash your face with a face wash. So at least face will not have acne. Okay, Shruti has asked an interesting question. So one more question I will take, that endometriosis and cyst. Okay. See, endometriosis is different, cyst is different. Okay. Both of the things can be diagnosed by gynecologists. They do it very routinely. Now coming to thyroid. Okay. Thyroid versus cyst, completely different disease, dear. Okay. Now you will see that symptoms overlapping. But in thyroid, what are the symptoms which are overlapping? Irregular menstruation, obesity, and cold, feeling of cold in the thyroid. Okay. So someone who has hypothyroidism, she will have depression, she will feel cold, she will eat less. PCOD people eat more. This thyroid person will eat less and she will gain weight. And the test is simple. You do blood test, T3, T4, TSH, and you diagnose thyroid. Some of the symptoms are overlapping, but the diagnosis is not difficult. It's not a confusion diagnosis. Completely different, actually. Very good. Those who are written, I am happy, always happy, almost happy. Very good. Probably you are yet to be married or you have a good life partner. Very good. There is a question, what are the physiological symptoms of PCOD? I don't know what is the term of physiological symptoms. Symptoms are symptoms. Now, this is a fancy word. Physiological, functional, technical. We already covered the symptoms. Nikhila has asked an interesting gynecology question. A patient without any symptoms but low bleeding every month, should they go ultrasound because there is a low bleeding? See, for every girl, every woman, the bleeding is different. Someone may have less bleeding every time, normal. Someone may have heavy bleeding every time, normal. What is abnormal? If you have less bleeding, then intermittently you have heavy bleeding, then again less bleeding. That is abnormal. If your low is less, it's okay. That is for your build. That is for your uterus. Okay. If you don't have other symptoms, you don't need to do anything. But if you are disturbed with it, you are anxious. Oh my God, what disease I have and all those. Better you go to gynecologist. She will say you have nothing. Then you should relax. So for your psychological well-being, you can go visit a gynecologist. Otherwise, not required. Spandana has asked how to address the condition. Thank you, Spandana, for reminding. I was that day, that time, lifestyle, I missed out this part, the sleep, okay, and mobile. So there are two problems, okay. One is mobile addiction because you are anxious, you are stressed, you are depressed, you want to escape from the real life, and you get hung up with your mobile, right? You are stick to your mobile. You are mobile addicted. So you are spending 8 hours, 6 hours in your mobile. That you need to reduce. Make it to 1 hour. Now, how to do that? I don't know. You will have to use your willpower. You will have to do something to yourself to make yourself reduce your mobile and utilize that time from something useful. Okay. How you do that? I also don't know the answer, but you will have to do it. The second part is sleep. Prepare your mind for sleep after 9 p.m. or so. Stop mobile and all those things. Read some book. Yeah. So if you have interest on psychology counseling, you can read psychology counseling. If your interest for this child assessment book, You can read the child assessment book. If you are interested for helping people who are going through divorce or marriage relationship counseling, you can read this book, Marriage Counseling, right? Or you can join these courses so that you learn, read the book, and practice on the clients also and help people. So sleep is very important when mobile is also important. Yeah. So iPhone has asked a question. I don't know who is this iPhone, but I understand that she has iPhone. Okay. So why don't you rename yourself, dear, by your own name? So what about the cervical vaccine? Cervical vaccine, PCOD has no relation. Cervical vaccine is for cervical cancer. You are not supposed to take the cervical vaccine at the age of 30 or 40 years. Not useful. Try to understand why the cervical vaccine has come. What is it? It doesn't prevent cancer directly. It prevents, it is immunity against viruses, herpes virus, cervical, the viruses which are going to attack cervix, and these viruses can lead to cervical cancer. This vaccine is not for cervical cancer. This cervical vaccine is for viruses which are going to attack your cervix. Now, from these viruses are coming, it is coming from multiple sex partners. What is the age group now? 16 years, 18 years, 20 years. Typically, most of the someone, this is a worldwide data I'm saying, okay? Someone who is under the age of 30 will have more number of sex partners if that person has multiple sex partners. After 30 years, that may reduce to only one. So the benefit of taking a cervical vaccine at the age of 30 is less. That has to be given at the age of 16 and 18. That too, typically for a higher risk group. So who is a higher risk group? Either the woman or the girl is in promiscuous relation, or the spouse or the partner is promiscuous. Those people, that couple will benefit more with the cervical vaccine. There is no benefit of cervical vaccine at the age of 50. When you already got herpes, when you already got the infection, your vaccine is not going to prevent anything. Okay. Similarly, in hepatitis B, what happens in hepatitis B? Hepatitis B vaccine, you say that it prevents liver cancer. Technically, it prevents hepatitis B actually. So the liver is infected with hepatitis B, and this causes liver cancer. So what you are doing, you are giving a hepatitis B vaccine, protecting the liver from hepatitis B. So cancer will not happen. But once you have hepatitis B, this cancer may happen. Similarly, for cervical vaccine, if you already were in a promiscuous relationship, someone in a promiscuous relationship, multiple partners, or the spouse or the partner, boyfriend has multiple partners, this woman is already exposed to this viruses. Now, the vaccine may be useful, may not useful. But after 30 years, 40 years, there is no point. I don't know the short form card. Yeah, Shruti has added one more thing. Thank you, Shruti, for adding. Stay hydrated. Yeah. Drink a lot of water. When you are taking a class, drink water. When you are listening to the class, drink water. And the research also says you should start your video cameras for the class. When you start your video for the class, you feel happy because you have been so much depressed. You are not woke up today and maybe didn't have bath and didn't comb your hair. So when you attend a class, you prepare yourself. You bathe, you comb your hair, you get ready, you try to look good. So it makes you feel happy. Yes, I'm going to attend today's class with the video on. That releases happy hormones. When the happy hormones are released, you prevent PCOD, you prevent lifestyle diseases. So for lifestyle diseases and PCOD prevention and management, one of the things is you have to attend all the classes with the video on. Very good. Very good. There are still some hopeless people. They are like already depressed and hopeless. So कुछ नहीं कर सकते. But there are some people who still have hope. They have started their videos. Very good. So Sarah has asked an interesting question. Puberty, multiple cyst, menorrhagia, how to plan a diet regime to regulate the cycle. Again, a wrong question actually. What we have learned, everyone now write down. What is your management plan? 4 words for PCOD. Number one is psychology well-being, psychology counseling. Number two, lifestyle, which will include yoga, meditation, mobile, sleep, hydration, everything. Walk in the garden, hobby, new learning, helping people, everything lifestyle. The third is the diet. Then fourth comes the medicines if required. So as a nutritionist and dietitian consultant, you will restrict to this three. Understood? So now this diet cannot be the first thing. Diet is not the thing that will reverse PCOD, that will prevent PCOD. The key is here, psychology counseling, then lifestyle changes, or both parallelly. Okay, Spandana has asked an interesting question, not related to topic, but I will answer this. Melatonin. Does melatonin supplements help for sleep issue? So I keep traveling, like a lot of travel is there. And one time I had like sleep disturbance. I get it frequently actually. I don't know, even when I don't travel. So I tried melatonin and I realized it's not good. Then I research on it that what is the side effects of melatonin. One of the common side effect of melatonin is depression. Okay. So you take single dose of melatonin. Next day you will feel no smile. You take second dose of melatonin next day. Third day, you will feel your face is completely flat, no emotions. Then third day onwards, you will start feeling depressed. People will say fourth day onwards, hey, why you are depressed? You don't know the reason. You might say that it is a sleep disturbance. No, but it is melatonin actually. Okay. So, anyways, melatonin only doctor can prescribe. It's a Schedule H drug. Yeah. So Jasprit has added now fifth component, right? So basically, this is a third component. When you say supplements, when you are talking of nutrition, now we come to the major of your interest, okay? Which should be the last thing actually in PCOD. So the nutrition and diet. Now I will take next 15 minutes. What should be your nutrition and dietetics plan? Okay. So remember in PCOD, what are the 4 components? Psychology counseling, lifestyle modification, which includes yoga, meditation, exercise, running, walking, hobby, helping people, helping a household, and drinking more water and less mobile. All these things. Learning new skills, reading a book, sleeping properly. Number third is nutrition and dietetics. I will take that for next 15 minutes. First, I want you to ask some question. Those who ask some silly question, they will be my favorite. If you ask a foolish question, you are my most favorite. So ask any question, ask. Hmm. Nita has asked an interesting question, but these days many doctors prescribing melatonin sleep inducers. So Nita, write down right now in the chat how many doctors have you visited, and out of those, how many have they prescribed you melatonin? You might have visited 1 or 2 doctors. You cannot generalize that everyone does that. No. Okay. That is, you visited 2 doctors, probably one doctor or both doctors they prescribe melatonin, or you ask them melatonin. It's not the world. These 2 doctors are not representing the whole doctor community. Most of the doctors they don't prescribe melatonin. I tell you. So if you want to check the data, you check the sale of melatonin. How much melatonin medicine is sold in India? You check this data. You will find out very less. And it's a scheduled drug. Okay. So don't generalize things to rationalize your own misunderstanding, misconceptions. Okay. Cecil has asked an interesting question. I will take a break of 1 minute. I will sit like this, like a statue. Breathe, because that is what important for psychology counseling, psychology well-being. I will breathe. Then I will drink some water. You also smile. You drink, you breathe. Yeah. Now to breathe, how should you breathe? We will learn that also. For psychology counseling or emotional well-being of any condition. So we'll learn one breathing today. In the meanwhile, you can write your questions. Don't forget to smile. If you don't smile, you are not happy. If you're not happy, you are depressed. And if you're depressed, there is a chance of PCOD. Oh my God, you don't want that. First step to prevent PCOD is smile. Okay. Lakshmi has asked a very horrible question. Okay. So, Meftal, all these medicines are scheduled as drug, my dear. So you should not take on your own. Schedule as drugs to be taken by on the prescription of doctor only. Yeah. There are some people who live on Instagram and Facebook. Okay. They are like so many things they put on the post. They think that they will get some client or they will feel happiness. No, actually, you are feeling sad. You go to that same post next day or after 1 hour and you see, oh no, 10 people liked, and you still feel sad, empty. Yeah? Not required. So the client acquisition is a completely different ball game. Okay. Putting post on LinkedIn, putting post on Instagram doesn't give you client. You can do it for your fun set. Just because you don't want to spend time fighting with your spouse, so you spend more time on Instagram and LinkedIn. So that's a good thing to do. But the objective is not to get client there. To get the client, you have to do a lot of things. And those lot of things, if you cannot do, then you come to me. You take my internship, then after the internship, you get empowered with me. Okay. And start getting paid clients. Mayur has also an interesting question. Is some Shatwari Kalp helpful with period pains or PCOD? Ayurvedic medicines help. Huh? So I firmly believe, though I'm a medical doctor, but there are some Ayurvedic medicines which help. Okay. But now, the problem with Ayurveda is it is not regulated. So there is no scientific study done systematically that you give this medicine to this people, give this medicine to this people, give placebo to this people, and then this is outcome. So you have to take it from a good company. Okay. I personally believe Dabur is a good company for Ayurvedic medicines. Himalaya is also good. My first preference is Dabur. Others I don't count. So the case study which Khushbu has mentioned that in one of the scan of a client, some follicles were found, but not a cyst. And the patient has been suffering from irregular period facial hair. You need to do hormonal test now. You want to find out what is the testosterone, LH, and FSH level. That might be one reason. The second can be it is at early stage. It's good. Now probably exercise will prevent it. Okay. Most likely such people they are having some hormonal imbalance. May be related or may not be related to PCOD. So there is an interesting question. A puberty girl, can you give oral contraceptives? Actually, her mother may not like it. And oral contraceptive, a gynecologist may decide to give to a young girl if she finds it more beneficial as compared to what is her condition. But uh, you should not be giving that. Okay. Oral contraceptive pill indication, as per studies, is not PCOD. It is to prevent contrast, to prevent conception. Will PCOD go away after menopause? PCOD starts with teenager age, adolescent, 18 years, 16 years, 20 years, continues for the time when you need your ovaries, continues during the time when you need fertility, continues during the time when you need your hormones balance. If it goes after menopause, it doesn't help actually. So you should not, a client should not wait that, oh, PCOD will be relieved by menopause, because by the time life has already ended, correct? Technically, the function of ovary is already gone, right? Why you got the ovaries? For hormones and for fertility. But now, when you reach menopause, that is gone. So the symptoms may subside now. But what is the use? Yeah. Shruti, we covered this, dear. Okay, it's time for fun. Before we start nutrition and dietetics for PCOD, it's time for fun. Which painting you like most? Write down in the chat, please. If which painting you like most? The sunset one. Which one is sunset? Which one is sunset? Yeah, the water, ocean, sunset. Okay. You want to see it close? Shall I bring it closer? The blue in the center. Oh yeah, yeah. The top blue. Yeah. The purple trees. Yeah, that is. Oh, purple tree. Yeah. Okay. Okay, I will bring it closer. So only those people who have started their camera and those who have smile on their face, they should see. Huh? Others, they close your eyes. Okay. I'll bring it. So if you want to see, uh, have a smile on your face, I'm bringing it. Okay. You like that one blue one? See the center painting. This painting is the cover of the book. This is the cover of the book, right? Psychology, this center painting. Yeah. You find this? There is a couple. There are two kids. They are doing fishing, right? Then there is a shadow of the house. Yeah. So the name of the painting is Happiness or Happy Family. Then what did you like most in this? The sparkle, yeah, it was a tough part. So the name of the painting is The Couple. And this painting is on the cover of couple therapy book. Okay. So those who do marriage relationship counseling and family therapy program, they get this book. So there are couple therapies. So in marriage counseling, in the market, people are talking from their own wisdom. They don't know what to do. They watch some Saas Bahu serial, then they teach how should you fight systematically. No, ideally, you should do first relationship test. Okay. So this is also painting. I will show you. So you will do relationship test. So there are 25 relationship tests in our syllabus of marriage counseling. Most of the lawyers, court marriage counselors, psychology counselors, NGO owners, yoga people, tarot card, freelancers like you, nutrition dietetics, they do this marriage counseling course. In this, you learn test for to identify what is a issue between the couple, whether there is an issue of love, respect, trust, compatibility, communication, goal sharing, affection. What is your issue? So there are 25 relationship tests. So the relationship tests are called relate pillar. Okay. And when you use this relationship test, you can engage the client for 15 to 20 sessions. It means from one client, you can earn 20,000 rupees, even if you charge very average 1,000 rupees per client. Normal marriage counselors, fees is those who use the relationship is they are able to charge 1,000 to 2,000 per session. And they engage for 20 sessions. You will learn this. So the money is good in marriage counseling. 20,000 from a single guaranteed. And if you want clients, that is a problem. You can come to me. You can take my internship. You can get attached with me, like 500 freelancers, and start getting paid clients, start earning. So in this, you learn how to identify the problem between the couple. Now, to solve the problem between the couple, you show them this painting on this book, and you do couple activities. So there are couple activities, around 100 couple activities in this book, where you learn how to improve trust, how to rekindle passion, how to reduce boredom, how to improve your friendship, how to have common goal sharing. So there are activities. Such a systematic plan is there. Yeah. So you become a systematic marriage counselor. Typically, lawyers, court marriage counselors, they do our program of marriage counseling and family therapy. Not only for certificate they want to put in the chamber. Yes, that is their primary objective, but they want this copyright content. So this copyright content, both of them not available outside. And you can use it on your clients, individual clients, when you enroll for the program. So this one. So we'll do something on this one. For breath, what did you like in this painting? Write down in the chat. So brush was not used. Yeah. This painting was made with palette knife without using brush. It's a 3D painting. It means the forest is going inside, deep inside. Yeah. The name of the painting is The Wet Forest. You know, your mind should not be dry forest. Your life should not be dry forest because it gets ignited with fire. It burns easily. If you have a dry mind, if you do not cry, if you don't have emotions, if you are stubborn, if you are arrogant, the forest will get burned because you don't get affected by anything because your forest is dry. Right? You should have a wet forest. Mind should be like a wet forest. It thrives, it grows, it supports animals, trees, plants, flowers, fruits. So your mind should be wet forest. Wet forest will not get burned. It will thrive. It will help other thrive. Whomsoever come to the forest, grow with me. So always try to be the wet forest. We'll do on this breathing exercise. Okay. So whenever you get a client, start with psychology counseling, and to relieve their stress, anxiety, depression, do this breathing exercise. Okay. Everyone will do with me. This is breathe in, sit comfortably, back straight, feet supported. This will be breathe in. You will breathe in, and when you are breathing in, your stomach should come out. Okay. Stomach breathing. Breathe in, breathe out. Breathe in, breathe out. So what you're doing, you're breathing in more, you're breathing out less. So you are retaining carbon dioxide. When you retain carbon dioxide, it gets converted to bicarbonate in the blood, and that stimulates your midbrain. When it stimulates midbrain, vagus is also stimulated, and it relaxes you. It reduces your heart rate. It will reduce your respiration rate. It will increase the depth of respiration. It will neutralize stress hormones. You want to experience? Start. Breathe in, breathe out. Try to synchronize. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Now slowly follow the finger. whenever you get a client, first is emotional well-being, then comes lifestyle, then comes nutrition, dietetics, counseling, and consultation. And never comes a piece of paper where the calories is written. It never comes. Okay. No one cares for what calorie. No one cares what you're writing on the paper. That is a tool you give them to remember by something. Okay. Those who are interested to do psychology counseling parallel with your course, you can easily do that. You can talk to me. You can WhatsApp me. I will help you. There is one more painting I have removed from there. I will show it next class. Now, so much anxiety, stress you are going to have. You are going to WhatsApp me in the middle of night, right? So, okay, I will show you now. What did you like in this painting? Write down in the chat. What part you liked? Yeah, the lights. It is so realistic. The glow of the light, the raindrops. Yeah, yeah. It was one of the tough painting. It took me a lot of time, 4 or 5 hours probably. So, um, and then the umbrella itself, I don't know. I don't know why umbrella took me 30 minutes. It is supposed to be the easiest part. Yeah. The reflection of light, yeah, somehow it came out very like in a first attempt. This all these light reflections, I had to put a lot of layers, multiple things, multiple layers. Then it came out that effect. Yeah. So when you see light from the rain from a distance, how it looks? It looks like something fuzzy, something glowy, glowy thing. Yes, canvas painting. You enjoyed? Should we come to nutrition and dietetics? That is the least important part of PCOD. Okay, that's why we will spend only 15 minutes for that. Okay. Those, in my experience, those who have gone through the turbulence, like out of these 500 people who are working with me as freelance, 60 are full time. What I have seen out of these 500 people, those who have gone through their own emotional turbulence, they are good psychology counselors. Those who have gone through their own marriage turbulence, they are the good marriage counselors. Because you understand what other is going through. Because you understand their issue. You reflect it. You can help them better. Yeah. Now, in our practice, in our group, we have divided the nutrition and dietetics for PCOD for two types of client. One is international, one is Indian client. Today, probably we will focus on Indian clients. 4 meals of the day: breakfast, lunch, supper, dinner. Number one rule: take it on time. Number two, do not have binge eating at particular time because that is a part of your craving. You have to restrain that. Number three, have light meals divided four. All the 4 meals, if possible, you add salad. Supper, you can restrict to fruits and salad, plus green tea probably. Okay. You can try to avoid lactose. I always say this. Now, in the market, there are all kind of people. They will say, don't eat aloo, don't eat potato, rice. What stupidity? What is the scientific data you have? Yeah, it's not that harmful, right? Don't take sugar free. I tell you the rationale of sugar free. Okay. Sugar is not the only source of carbohydrate. The milk of your tea is also the source. That is more harmful source actually. Okay. And if you are eating your sweets, if you are eating sweets with sugar-free sugar, okay, saccharol and all those, that is more harmful because the other component of these sweets also has sugar, also has glucose in it. So you don't want to. What happens if you tell someone that, okay, you eat sugar-free? So they will think, I'm not eating sugar, so I can eat more. Instead of one sweet, they eat 4 sweets. more harmful, yeah. It's better to eat one sweet with real sugar rather than eating four with sugar free. The second aspect, very terrible aspect, this sugar free component itself, anything you drink, diet coke, you drink sugar free, anything, or any medicine or anything, that component itself, sugar free component, saccharol and all, that is harmful for your intestine. So artificial sweetener we are talking, so that is harmful for your intestine. Something which is harmful for your intestine, it will affect your gut bacteria. When it affects your gut bacteria, then it affects your emotional well-being. Yeah, it affects your digestion. So you don't want that. Sugar-free, don't prescribe to clients. Don't you do also. Okay. Any brand. That is just to fool people. Okay. Just to fool yourself that I'm eating sugar-free, so I can eat more. No. Whatever you are eating other than the sugar, it also has harmful effect, probably more harmful effect. Right. Then comes, so your salad is done, water is done, exercise, that all we covered in lifestyle. Then we are told them that stick to the time of this. Then don't eat binge. Evening supper, you should preferably have snacks. Don't go empty stomach in the evening, because if you are empty in the evening supper, you will have craving for the dinner and you will eat more, or probably you will go outside for the dinner. Yeah. It happens very routinely. Breakfast, you can have anything and everything you want. Okay. Typically, South Indian food is better because of two things. One, they are light. The glucose spike is not there because sugar content is perfect. The second, it is good for your gut, for your intestine. So I always recommend start with this. You yourself don't eat ragi. You eat yourself something food and you tell your client you fancy food. Hey, from tomorrow you start eating ragi. They're like, yeah, okay. So they are like, hey, चल आगे चल. So खुद नहीं करते, हमको बता रहे. And they cannot do that. Okay. Tell them, do you eat ragi on a every day? There is a logistic for eating any fancy food. Some people, they ask avocado oil, all this oil, this oil. There is a logistics. It comes with price. You have to order it separately for yourself. In your kirana order, that has to come. Then you have to cook it separately, right? Then you have to eat it separately. Other people may not like it. You also may not like it. You may not have developed a taste for it, right? So you cannot switch to ragi at this age. Okay. Whatever you eat, you tell me first. The client will say, these stupid things I eat. So you say, okay, this is wrong. This is okay. You stop this, you continue this. Someone may say, I eat cake in the morning for breakfast, donut in the morning, breakfast, or MACD in the morning, breakfast. Yeah, I think you should stop that. But ma'am, I drink sugar-free, ma'am. Hey, shut up. That sugar-free is more harmful actually, and that doesn't replaces all these things. So you continue these good things. The better way, rather than telling the client that you eat something new, you ask the client what is your normal food component at your home. From that, you select and give them. Okay. It doesn't matter what is the dish. What matters is how you spread it. What matters is you avoid your craving. You avoid your binge eating. That's the mechanism. Okay. If you want, I will now read the diet which we tell the client. Okay. You can write it also, or you can preferably watch this video again. It will be there. Morning, South Indian food, snacks, very good. Idli, samar, dosa, uttapam, dokla, all those things. Okay. Yeah, dokla is Gujarati. For me, it is South Indian. Lunch. What will you tell the client for lunch? Roti, sabji, dal, chawal. Then what tension you are taking? Indian meal is this. Lunch is roti, sabji, dal, chawal. Dinner is roti, sabji, dal, chawal. What stress you are taking? It doesn't matter which vegetable you eat. Whatever vegetable you like, you eat it here. Okay. Probably calorie difference of 10 calories, 50 calories is going to happen. You don't worry about that. Okay. Now cooking style. Now you may have question whether I should put more oil, less oil. I'm going to tell you, eat only boiled vegetable. Are you going to do that? I eat boiled vegetable. Will you do that? No. What is your style? You continue that. See, the client has come to you one time. You cannot change their life completely drastically and say that, hey, start eating ragi, stop doing this, stop doing this, and then start eating boiled vegetable. No, it has to happen a gradual change. Okay. The problem is not the diet here. The problem is cravings, binge eating, irregular eating. First, you correct this basic problem. Binge eating, craving, and irregular diet. First, you control. Whatever you eat some nonsense things. You drink oil, continue that. But you maintain a routine. After the routine is maintained, then we go to the next step. Correct? You agree? How many of you agree for this? Write down, I agree. I liked it. So the first step is not complete diet change overall of the system. They are not going to do it. Okay, they are going to go to other counselor. They are going to go back to their bed and be zombie again. Objective, regular diet, no binge eating, no craving. To prevent binge eating and craving, you add your supper. Okay. You can reduce oil gradually. Okay, not today. Whatever is your preparation, you continue. Lunch is roti sabji dal chawal. Evening is roti sabji dal chawal. Supper is fruit, salad, some green tea, some whatever black tea, coffee, whatever you like. Okay. Don't tell fancy things to the client. You drink green coffee without milk. Hey, come on. Without milk, black coffee itself is bitter. The green coffee is going to be poison. And they don't want to spend money. You are not drinking it because you don't have money to drink green coffee. You are suggesting your client to do that. Don't tell them cook your food in avocado oil or olive oil. Yes, seriously, you are not doing it. Present oil is 110 rupees kilo, sunflower oil. You are telling them to shift to 1000 rupees kilo oil. What is this nonsense? And other people will not like in the family. Other people will not support it. Right? The food has to be prepared separately. No, don't create such a difficult life. Whatever you are eating, continue. Whatever you are able to do, you do that. If you eat one thing your family is opposing, you cannot do that. If you have to cook it separately, but you don't have time or energy to cook it separately, you cannot do that. End of story. Sometimes some students send me, so this is a diet chart I have prepared. I said, okay, I read only 4 things in that. Breakfast, 4 words in the diet chart. Breakfast, lunch, supper, dinner. I say, good. I don't read what you are written inside. Immaterial. Doesn't matter. Right? Okay. So some girls, they write this vegetable, particular, rajma, this. Hey, how does it matter if I don't eat rajma? Yeah. How does it matter if I eat beans? If I eat aloo? I want to eat aloo every 7 days. Yeah. What will happen to me? Nothing will happen actually. I prefer to do that. Yeah. I have a craving for eating paratha every day. I eat it 2 months. So what is the problem? No problem. Yeah. Whatever you like, you eat it. The only part you divide it and stick to the this thing. If you tell them no, lunch is rajma, she will do once in a year, and after that she will block your number. Yeah. Or if she is like me, a client is like me, she will throw the paper in dustbin in front of you. I got that such kind of paper 2 3 times in my life for parents and me sometime probably. And every time I thrown that, I could not understand what stupid you nonsense have written. Tell me now, what do you want? Yeah, your video is not clear. Yeah. Now done. End of story. Don't ask me, sir, which vegetable to give. Doesn't matter. Which roti to give doesn't matter. Which chawal to give doesn't matter. How much rice doesn't matter. Okay, someone prefers to eat rice than roti. You continue, dear. You continue that. Yeah, because 5 days you will prevent, and then suddenly you will start going to your pizza shop. Better it is you continue your rice shop. Yeah, doesn't matter. Which oil to use? Immaterial. Huh. As soon as you tell the client homemade food only, she is like, immediately after your appointment, she will go to pizza shop or she will go to pani puri thela. Yeah. So don't enforce. You ask them, hey, what are the things you eat? So these are nonsense, these are good. Okay? Tell them why you should stop this, why you should continue this. If they follow, it's good. If they don't follow, it's still good. Nothing can be done. Yesterday, someone wrote me WhatsApp, sir, I have a client, I have done this. She lost 6 kg, but I wanted to lose 20 kg. So I asked, what is your problem then? Good. So, sir, she is not following my instruction. I said, you cannot do anything. Yeah. She's not following your instruction, not your problem, not my problem. Go. Yeah. Do whatever you want. She's not going to do that. Nothing can happen. Good question, Shruti. So after hearing this, Shruti is like, sir, if they can eat anything and everything, what is my use? Your use is to tell them holistic approach. Don't act on the stomach. Don't act on the nutrition and dietetics. When a client comes to you, you have to stand out in the market. There are lakhs of nutritionists, so-called self-nutritionists, 12th pass nutritionist, doctor nutritionist, MSc nutritionist. Okay. When a client comes to you, you don't want to talk their language. You want to talk a language which will stick to them, right? If you follow the protocol which you learned today, then next time you refuse the client will still come to you. You say, I don't have time for you, the client will still come to you because you are the only nutritionist who is talking a holistic approach. Psychology, lifestyle, nutrition, diet, and you're not talking nonsense. Some avocado oil, olive oil, fancy food, ragi, yeah, oh, raju. No, you're telling them, what do you eat? Out of this, stop doing this, continue doing this. You are helping them select from their own diet. You understand? Client doesn't care for calories. Okay? And technically, do your experiment today only. Okay? You count your own calorie. Are you doing 2000 calories per day? I guarantee you are still doing less than 2000 calories per day. Whatever rubbish you are eating, right? And still you are going overweight. All of you I'm talking. Correct? Experiment, you do this today. Why you are going overweight? It's not only food. Don't stop blaming on the food, okay? It's because you are depressed, you are anxious, you are troubled, you are married, all those things. You attend classes without video. All this is causing your obesity. Yeah. So number one step is whenever you attend class, you start the video. Keep smile on your face, interact more, ask more questions. So this will reduce your depression. And when depression is reduced, you lose your weight or don't get your weight. Whatever. Yeah. You like this concept? So the funda is now holistic approach. Okay. Obesity is not the food problem. Obesity is emotional problem. Obesity is lifestyle problem. Okay. So your role is help them for everything. Okay. And help them prepare something which they will agree. Okay. Don't tell them something which is completely aligned, completely new. They will never listen to you. And if you want to learn psychology the best way, the practitioner level way, you join the course. You will learn counseling, actually how to conduct a counseling for each condition. We are a group of practitioners. Every Monday, 6:30, we take these classes. Tuesdays now. Okay. And you learn actually how to counsel the client. Done? You enjoyed? I have a question for everyone. We are not ending the class. Yeah. Those who are not replying to the question you enjoyed, there is only two diagnoses. One, they were not paying attention. They were fooling themselves by attending the class. Number two, they are so hopeless that they don't answer anything. If you don't enjoy, at least write, no, sir, I did not enjoy. Or if you enjoy, write, yes. That will motivate me to take more sessions for you. Oh, so nice of you, Nikhila. Very good. So it seems that there are no hopeless people in this class. So everyone is replying. Very good. Very good. I have two questions for you, everyone. Yeah, that's a good point, Neeta. So those who do internship with me, they get empowered with me and they start earning money after the internship. My process is very clear. I have changed my career two times, switched my career. Okay. So I know how difficult it is to switch a career. I understand that when you sit up in a freelance, either online or offline, the most difficult part is how to get client. So to get client, that problem I solve for you. Okay. I have a digital agency which takes care of your client acquisition. Okay. So I give you online clients to practice on your own. Now, two questions. What do you want to learn from this program? Everyone write in the chat. Okay. What do you want to learn? It can be simple thing, anything, everything. I will cover some topics. I'm not talking of the disease. Within each disease, both. Within each disease, what do you want to learn? Like you want to learn pathophysiology, you want to learn the symptoms, you want to learn the management, you want to learn the nutrition, you want to learn dietetics. Okay. Write down. Release happy hormone is there on the channel. You watch it. To help moms switch their kids unhealthy diet to healthy diet. So we have a program, pediatric nutrition and early intervention child development. Tirthana has mentioned very good point. Maximum mothers nowadays, they want to catch their children young, early intervention. That when is the physical growth and neurological growth getting blocked or interfere, then you intervene early for their proper growth. Because the physical and neurological growth, both growth are going to be affected if the child's nutrition is affected. So nowadays, mother are very cautious for that. So you can add this program with your present. Only one book will get added. Thursday classes will get added if you take pediatric nutrition and early intervention child development. You will get discount also. I will give discount. Okay. Very good. So Ankita, your half statement is correct. So you want to learn to manage all conditions with dietetics and nutrition. Wrong statement. You want to learn to manage all conditions. That is a correct statement. Because nutrition dietetics is not the only thing. You have to do other things also, dear. It is one component. Very good. Very good. Okay. So you are what you are given is the vision or something like that. But I was asking like in the classes, what do you expect? Okay. Do you want to write down in the chat? In the class, what do you want to learn? And keep giving me feedback of the classes which you are attending. Monday, Tuesday, Wednesday, Thursday. All the classes you are attending. If you don't like the classes, if you like the class, if something is not satisfied, if you think that some topic is missed out, if you think some topic was not covered properly, you keep me informed. Only if you keep me informed, I can intervene and I can do some early intervention child development. Yeah. Early intervention student development. EICDM. Okay, keep writing. Okay. And if you are interested to add psychology counseling or pediatric nutrition or fellowship, our seats are full actually, but I will see what can be done. So you can talk to me. Someone, those who are practitioners or who want to get a full-fledged practice, have an online presence, social media presence, you should bridge your certification gap with fellowship. When you have fellowship, your certification gap is breached, no one questions you then. Okay. Especially if you are a practitioner or if you are on social media or if you are an entrepreneur, then some competitors may pull you. Okay. So to avoid that, you go for fellowship. Very good, Nikhila. Very good. Okay, good. Okay, good. Dr. Dipti has mentioned the most important thing. Very good. You have a smiling face, so that's good. Keep smile on your face. in front of the client, in front of the husband, in front of the wife, in front of your children, in front of your in-laws also. And in front of everyone, in front of mirror also. Okay. So when you see your face in the mirror, don't be like, okay. So you have to smile. Yeah. Smile on. Okay. So basically, nutrition dietetics, the case studies are going to be the disease actually. Each disease itself is a case study here. Okay. You don't need to say that there is a girl who has come with this. Today, what we learned is the case study of PCOD actually. Yeah. Okay. The second question I'm coming. Let me see how many people are still there in the class. Oh, almost everyone is still there. Oh, okay. I I didn't realize that 2 hours are already gone and people are still there. Wow, it means very interesting and engaging audience. Sunday. If I start Sunday classes, which I will take, how many of you will be interested? I will inform once I start. Soon I will do that. Those who want to learn will join. Those who are not interested should absolutely not join. Those who are busy, try to take out time from your busy schedule. If you want to learn something, that is an investment you will have to do. Okay. Once your exam is completed, your classes are over. Okay. So all the classes for Sunday I'm going to take. You can talk to me for that. And you will learn actually practical how to do like today. Okay. Don't forget, you take up psychology counseling for this batch. The batch has just started this Monday only. Don't miss out. Okay, thank you everyone. And for exam brief, please watch the video on the link, the playlist, exam brief video, and all your questions will be solved. Even after this, your question, then you can talk to me Monday to Friday, 1 to 5 p.m. After 5, no WhatsApp, no calls. Okay. Thank you everyone. Because my number one priority is emotional well-being. No mobile after 5. That should be yours also. You also stop using mobile after 5. Yeah. Thank you, everyone. I enjoyed interacting with you. Very good audience for today. Thank you.